Well, aloha, and thank you for joining us for Spotlight Hawaii. I'm Ryan Kalei-Suji, joined by Yanji Denise. We apologize for a slight delay, of course, Yanji, as we sort of navigate through these times. We sometimes have some technical issues, which was the case this morning, but we seem to be on track right now.
That's right. And we have a very important guest. He is the person who is deciding so much for our city, and that is Mayor Kirk Caldwell. He is joining us live from his office at Honolulu Hale. Good morning, Mr. Mayor. Thank you for being with us this morning. Let's start with the basics. How are we doing?
So, one, I want to say thanks to Ryan and G for this service you provide to the people of the island of Oahu. It's a great thing you're doing. How are we doing? Well, today we have 45 cases on Oahu. So that's pretty darn good. That's below 50. It's below 49. To get into tier 3, you need 7-day average of 49 or lower cases and a positivity rate below 2.49. We're about 2.2 right now. So when you ask me how are we doing Oahu, we're doing pretty darn good. For a city of 1 million people, 2 weeks outside of Thanksgiving, we're doing pretty darn good. And the credit goes to all of your viewers, to all of your readers, who I think for the most part are complying with the requirements to keep us all safe. And if we continue to do this as we march into the holiday season, today is the first day we're going to be lighting up our Honolulu Hale Christmas tree and our displays in front of the Hale. As we go into this holiday season, Hanukkah, Christmas, and the New Year's, we can open up. We can do this if we're careful.
You know, another issue that continues to be discussed and debated over is this safe travels program that the state has implemented. And we know that there have been some pushback by some of the mayors that we've spoken to in the other counties. And we've heard proposals that has been pushed forth by your administration. What are your thoughts right now on the status of the safe travels program, specifically concerning that second testing upon arrival? What are sort of the discussions that you're having right now with the governor and the administration on that?
Well, as you probably know, 2 weeks yesterday, we sent to the governor a requested change to our order and our tier system framework. And it basically is 3 things we're asking for. One, those visitors or residents who come into the state with a pre-test, but they don't have the result, but they went through the effort to get a pre-test, but they don't have the result yet because of the surge in cases up on the continent, then instead of being forced to quarantine for 14 days, or now I understand it's going to be 10 days, they could get a second test at our mobile lab out at the airport and get out of quarantine once they receive a negative result, which at our lab happens within 2 to 3 hours. And we think that's 2 tests now, safer than just 1 test, and you don't have to go into quarantine. Being forced into quarantine right now is not a good thing for Oahu, because there's about 20,000 people in quarantine on any given day that HPD has to enforce against, and it becomes harder and harder as more and more people are in quarantine. So getting people out of quarantine, knowing that they're safe and don't need to be in quarantine, is the goal. So that was the first request. The second one is people who get the CISA exemptions. These are exemptions you get because you're coming back and forth from the continent to work in Hawaii. We want them to be tested. We believe that testing these individuals is another way to safeguard against people coming in who may be positive, particularly with the surging in cases up on the continent. And the third component was those who just don't get a pre-test. Maybe they can't find a lab where they are, or they can't be guaranteed they'll get a result before they leave. So they show up, and now they're forced into a 14-day quarantine, soon to be a 10-day quarantine, that they'd be offered a test at the airport that they would pay for. It's a PCR test. They get the result in 2 to 3 hours. They download a contact tracing app, and then they quarantine. We asked in our order for 4 days, and get a second test on the 4th day. And if they remain negative, they're out of quarantine. Our goal is to test as many people coming in as possible to get them out of quarantine as quickly as possible. Now, if Department of Health doesn't like 4 days, we're willing to go to 7 days. And as you know now, they're requiring a 10-day quarantine. So maybe 7 days with 2 tests, as opposed to 10 days with no test, is a better option, particularly if they continue to remain negative during that period of time. We haven't heard back from the governor. I'm still hopeful he'll give us a green light and allow us to amend our order so we can put this into place.
2 weeks is some time. That seems like it would be enough time for them to review the request. Do you know why they haven't responded at this point?
I don't know why. We were told in the early days when our authority was taken away, all the mayor's authority was taken away from the initial actions we were taking, that we'd hear back within 24 hours. Well, that time is long past. I continue to push when we talk to the governor along with the mayors, and I remain hopeful that we'll get some or all of the requests that we've made. I think they're reasonable. I think it promotes health and safety while opening up to visitors. So instead of doing a lockdown on those who don't have a result but tried to get a test and don't have the result yet, we allow them a second test and an option to get out of quarantine. This is going to help our visitor industry. And we need a strong visitor industry, but we need it with the health protocols. And I think the second test option gives even more protection to those coming into our state during the holiday season. And that's why Yunji and Ryan, we'd love to get this resolved now, because we're going now into this potential increase in visitors who want to come during the holidays, a week before Christmas, a week after Christmas, a little bit after New Year's. Let's have this program in place so this can happen. We have the capacity at the airport. We can do 10,000 tests a day. PCR, gold standard test, rapid turnaround. That's 300,000 tests a month. And a lot of capacity is not being used. It's going to waste, and we hope we can put it into action to open up to more visitors that are coming in healthy, staying healthy, and leaving healthy when they go back to where they came from.
That you've stood up this testing facility at the airport. How long is that going to be there? Because we know that CARES Act money is coming to an end, and there is some question over what is technically funded through CARES Act money, what will come to an end. Is that laboratory one of those that will continue to remain up even after CARES Act funding has been depleted or expires at the end of the year?
So the mobile lab at the airport remains in place. We spent about $16 million to purchase a lab, to staff it. It's paid up front, so it'll continue to operate after December 31st and after the end of my term. We also purchased 42,000 test kits. So that's already been expended. It'll be there to be used into the new year. And the goal is to continue to have that lab up and running and become self-sustaining, because those who come in under certain protocols will have to pay for the test up front. It's $125 for a test. That's cheaper than people are charging up on the continent. And that should help it keep it going. It'll be self-sustaining. And then the other thing, just for your information, the lab is set up in such a way that can also help with the distribution of the vaccination once that starts arriving. And right now it's inward facing, swabs go into the lab to be tested, but there's 4 office spaces in the mobile lab that could open up with doors to the outside. So people could come in and get vaccinated twice, and that's another way to distribute the vaccine. So it's going to cover both, and I hope it will be used for vaccinations sometime in the future as more and more doses of the vaccine are brought to Hawaii.
We understand that you can't speak for the mayor-elect, but there is a question here from Jeff Hopel at 1042, Ryan. It says, will the next mayor keep the tier system? Can you tell us a little bit about the handoff that is taking place? We know that the new mayor will be sworn in at the beginning of next month. Do you think that from your conversations, is the tier system sticking around?
Well, I don't want to speak for the mayor-elect. Every mayor gets to come in and build their team and develop their policies. But we have met with the mayor-elect and his managing director designee, 5 or 6 meetings now, each of them about 2.5 hours long, covering all kinds of topics. We're also going to be having some further meetings regarding some of those who provide advice and services to our community, including our medical panel that we get advice from. And I have recommended to him that I think the tier system works. We see it discussed by members of the media every day. Even we hear it on the radio. We can move into tier 3 if we keep the case load below 50 and positivity rate remains lower than 2.49%. It projects to people what can happen if you take certain kinds of actions and what you don't want to have happen if you let down your guard. And I've recommended to the mayor-elect that he keep the tier system in place, but that's his choice. And perhaps he has a different model, a better model that he wants to put in place, and that'll be up to him.
Earlier you had mentioned that there was up to maybe 20,000 people in quarantine, which is difficult to, of course, regulate and for HPD to have to enforce. How is that enforcement going with that many people in quarantine? And how are you folks, how is HPD and how is the city and county trying to keep accountable to those who are supposed to be in quarantine?
So in theory, there should be 3 phone calls a day to everyone in quarantine, 3 times 20,000, or 3 knocks on the door 3 times. I mean, knocks on the door 3 times a day times 20,000. That's impossible to do with 2,200 police officers, of which, they're not all working 24/7. So instead, they are doing sporadic enforcement. They are knocking on doors and they are making calls. And people are calling me, say, Mayor, HPD called, and later they knocked on my door to make sure I'm in quarantine. So by doing this randomly, I think it's sending a message. You don't want to be one of those people that's found out that you are violating quarantine, because you can be warned and then, of course, cited. And under 127A of HRS, it's a criminal offense, which is not a pleasant thing to get. So that's what HPD is doing. Now, I think the better outcome is that fewer people in quarantine, because more people are being tested and they're determined not to be positive, and therefore they can go about their lives, both visitors and residents coming home.
What's your take right now on safe travel so far? Do you think that the program should continue as is without, let's say the governor does not grant what you're asking for, given the case counts on the mainland, especially in gateway cities, places like California, Las Vegas, the markets that are all coming to Hawaii? What are your concerns going forward if your requests are not granted?
So what I do think overall, the Safe Travels program is working, at least from what we've been told. For Oahu, we do not have evidence of visitors coming in who are positive, who are spreading it to residents. As far as we know, we have no evidence. We do have more accurate information for the island of Kauai in terms of the number of infected visitors coming into the island, despite the Safe Travels program. As you know, I feel that there should be a stronger surveillance testing program. It's ended. I prefer to see it continue to operate by the state of Hawaii. They control the airports, and I support the methodology of 10% of the arrivals being randomly selected and tested 4 days after arrival. That would be important information for all the mayors. Speaking for myself, I'd like to get that information every day, just like we get the case count and positivity rate every day. And it would tell me what additional action I need to take or request action to the governor that I'd like to take, given what we see. But I would say with the information we've been given, I think overall the pre-travel testing program implemented by Governor Ige seems to be catching a lot of visitors who would otherwise be arriving on shores positive. Part of it could be self-selection. Those who test and are positive obviously aren't coming. Some don't want to test and don't want to travel because they're afraid that maybe they would test travel. And I think those that are willing to take the test are probably those who are probably more cautious generally in terms of their lifestyle. And all of those things are good things.
Mayor, your time as mayor is coming to an end at the end of this month. I wonder if we can just spend some time to just sort of reflect back on sort of not only this time of COVID, but during your time as mayor. What are you looking back? What are some of the things that you can say that you're most proud of that you've been able to accomplish during your time here as the mayor of the city and county of Honolulu?
As you know, when I ran back in 2012 and again in 2016, I ran on 6 priorities. And I'm the type of politician who ran on one set of promises and then came and governed on another. I stuck with the ones I ran on, and I governed on them too. And they're critical priorities. They're things that are important to all of us. Repaving roads, 2,300 lane miles paved. Rebuilding our sewer system. When I came in, there were 200 sewer spills a year. Last year there were around 30. Reestablishing our bus routes and adding more, and now converting to an all-electric bus system. First electric bus is coming in, has arrived yesterday on our shore. Improving our parks, restoring restrooms, playgrounds, play courts, focusing a lot on Ala Moana and Thomas Square, two signature parks, the most heavily used park in the state, Ala Moana, the most historic park, Thomas Square. Rail, highly controversial, but I'm proud of the fact, it'd been easy to duck and run, given all the problems that we faced with rail. But during our 8 years, we fought hard. We've now completed or have under construction 15 of the 20 miles of it. And we have less than 5 miles remaining, the really difficult ones, and we continue to fight for that, even in the last month of my administration. And then homelessness, for all the problems, and there are huge problems. In some ways, I think it's much harder than COVID-19 because there will be a vaccine with COVID-19 and it'll come to an end. But homelessness is a huge challenge for mayors around the country. And I'm not aware of one mayor who's actually solved the problem, but we've tackled it through compassionate disruption. I know it's somewhat controversial, but I know our enforcement actions have made huge differences in Kaka'ako and Thomas Square and Stadium Park and Mother Waldron and many other parks around the island. But we continue to have homeless in our streets and in some of our parks. But then the compassionate side, innovative things like our Punavai Rest Stop, where we have a hygiene center operating 24/7 under the pandemic. Our upper floor is being converted to a medical clinic and housing first. Our Sand Island facility, where we have low barriers in housing people. Kaho'ike Village, where 500 women and children now reside in this public-private partnership. The Montgomery Motor Site, which will be completed shortly, where more people will be going to be fed and housed. River of Life, hopefully, will be moving their feeding program out there instead of in Chinatown. Acquiring thousands of units in the city or building them for housing first and housing our homeless population. A lot of compassion there. I'm proud of those things. And then there's a lot of others. 53,000 LED streetlights replaced, brighter lights, more energy efficient. And the list goes on. I mean, there is a lot of things we've plowed the ground. We've worked really hard. We stayed the course. We had some big dreams. Some we've accomplished, some we haven't. Climate change, we have this office now where we're doing a lot of challenging things on climate that are not about today, but about 20, 40, 50, 100 years from now. And that shows courage that we're taking action now for future generations.
Well, let's talk next. Oh, sorry, go ahead.
I'd say my biggest disappointment, that I'm running out of time, that I don't have more time to do more. And I wish I had another term to complete rail. I really do.
Well, obviously the mayor's office, the time is up there, but there are other offices in the state. Are you prepared to announce anything today? Do you want to talk about any next steps?
I'm not prepared to announce anything. I mean, short term, I'm looking to write a book or two. I'm looking to maybe teach a class or two. I'm going to take off some time and go to South Point and camp and fish. Go to some of the neighbor islands where I have friends and, hike and relax. And then I'll come back and focus on what I want to do next. But I have to say, I'm not ready to retire. I'm not ready to give up on public service. I love it. And I love the executive branch more than the legislative branch, which I served in as a majority leader in the House. And so I will be looking on how I can serve at an executive level in the coming years.
Can you tell us the working title of your book?
Well, one I'm looking at is to tell stories of those who showed incredible courage during the pandemic. People I just became aware of, and they're heart-rendering stories of courage, which I think is about true leadership. And so I'm going to look to maybe select 12 people and focus on telling their stories. It won't be famous people, but people who I think deserve to be recognized. So that's the book I'm going to be working on. I've started to select the individuals who we'll be talking about. And then I've thought about doing more of a textbook on rail, but it's more about infrastructure, complex long-term infrastructure projects that last beyond one term of any executive, multiple terms, the challenges you face, but the importance of getting it done. And focusing, big at first, looking at rail systems around the world, but then bringing it home to our rail system here on Oahu.
As you sort of pass the baton to Mayor-elect Blangiardi, what are some of the things that you're telling him, as you said that you've already had meetings? What are some of the things that you are sort of advising him on that things that, of course, COVID-19 is going to be something that he will have to spend a lot of time to make decisions on and have to govern over. But what are some of the other things that are sort of advice that you may be giving to the mayor-elect as he sort of enters his first few months in office?
Well, at our last meeting last week, I think Thursday or Friday, I spent a lot of time talking about when you have natural disasters or emergency situations. The pandemic is one of those. But the more common ones are hurricanes, tsunamis, strong wind events, and flooding. And I told him there's no more important time for a mayor than during those times. You know, civil defense is a priority for the counties. It starts with the counties. And so we talked a lot about, being ready to act. In fact, over preparing and overreacting, going down to the OEC early, staying throughout the event, making sure that all bases are covered. I gave them a binder on the different types of events and what should be focused on. And so that was the most recent thing we talked about. I think it's critical. And of course, when these are occurring, you're also on the news talking about them. Talked a lot about rail and the challenges that we face. Talked about the budget and the ongoing challenges there as we climb out of the pandemic. As mayor, I've been relatively lucky. We've had a strong economy. When I came in, we were still in furloughs, and we came out of that my second year of my first term. But talked about how we're working to balance the budget before the end of my term, even though it doesn't need to be completed till March. And what are the challenges to find the revenue to keep essential services going, while making sure that our bond rating, which is a AA plus, a very good bond rating, remains in place. So we talked about fiscal issues. We talked about, the different departments and what the importance of these departments are, some of the problems in the departments, some of the challenges, and of course, some of the successes. So we spent hours now talking on all aspects of city government. And we talked about politics, interacting with the state legislature, with the governor, with the other mayors. And I think for me, when I came in, we had no transmission with no real smooth handoff with the previous mayor. But I did come in with some knowledge because I was a managing director and acting mayor before the previous mayor. But I can't think of, we've done a lot of hard work to make sure this transition is very smooth, because we really care. We've done briefing books from every single department, and we've made our department directors available to brief in person if they want to. I think the new mayor is going to land with his feet firmly set in the ground and be ready to lead. And that's a good thing for all of us. And I'm very hopeful and positive about it.
You are still the mayor for the rest of this month. How soon could we get to Tier 3? And what are you advising people when it comes to the Christmas holiday? We're in kind of a weird situation because we are inviting visitors to celebrate with us. And at the same time, the messaging seems to be to Kama'aina to not travel and not see each other. So what's your message for the holidays? What are you advising people? And how soon could we get to that third tier?
Well, I am hopeful that we could get to it by Christmas. It's going to be relatively difficult unless we see more case numbers like we saw today and yesterday. But we know we can do it because look at the numbers in the past couple of days. We had a couple spikes the days before in the 80 case range, which is not going to be helpful. But again, it's the basic. Don't gather in groups larger than 5 unless it's your household or living unit. Be 6 feet apart. Wear your face coverings everywhere if possible. I know sometimes you don't have to, but even when I'm out there jogging by myself in the late afternoon or early evening in Manoa with no one in sight, I wear my face covering. Just be extra careful. If we do this, we can have visitors arrive on our shore with the testing program, as long as they're following the other protocols, and can move it. It just requires discipline. And to that point, this past weekend I went for a light, saw District Park with adults, no mask wearing, whistle blowing. And I just thought, guys, you're risking getting sick and getting others sick. but you're also setting a really bad example for everyone else who's trying to comply. And so I would like those kind of folks to realize that while you're healthy, you got to be really careful, because healthy people can get sick too, and you can spread it to people who are not as healthy as they are. If we do that, we can move into these lower tiers and continue to celebrate life until the vaccine is widely distributed. We just had a meeting before this call talking about the initial vaccine program that's going to take place probably starting in the third week of this month. First responders first. But can you believe it? Before the end of the year, we're going to start vaccinating all of our first responders, about 5,000 first responders in the city and county of Honolulu. And then we go out to others, those in care homes, Pacific Islanders. And I believe in the first quarter of next year, people like you and I will be getting vaccinated too. And by June, we could be starting to see this COVID-19 pandemic fading away. There's a lot of hope there. We just got to stay the course between now and then. And I know we can do it. So don't give up. Don't get lax. Don't see the light at the end of the tunnel and say, hey, we don't need to worry. We need to worry. But if we do this, we can come out even stronger and brighter.
All right, Honolulu Mayor Kirk Caldwell, thank you so much for taking the time to join us this morning. We know that you are a busy man, and we appreciate you always taking the time, and also just for your time over the past few months during this pandemic and joining us here on this conversation. And even before, during the hurricane warnings, we spent some time together here on these different various broadcasts, and we certainly appreciate you being open to joining us and speaking to the viewers with answering their questions directly.
No problem. Thank you so much for all you do. Be safe.
Aloha. Thank you,
Aloha.
Mayor.
Wow, very interesting, Ryan. We got some more information about his safe travels request to the governor, some new things there, the things that he's asking for. But of course, what so many of us are interested in is next steps. And he talked about 2 books that he's already starting to work on, some travel plans for himself, and he gave a not so veiled hint as to what's next, saying that he prefers an executive role, not a legislative one, and that he's not done with his political career just yet.
Yeah, not quite ready to make an official announcement here on this program, but certainly one that we know will be likely coming from the mayor sometime in the future about his future political plans. And, everyone seeing that he is eyeing for the office of governor in a few years. But going back to some of the comments that he had earlier, specifically about COVID-19, him kind of voicing some frustration about the lack of response that he has gotten from the governor on his proposal for the second testing at the Honolulu airport and the stand-up laboratory that they have put in place there, saying, when they initially began this process, saying that the governor's office said it would take 24 hours for them to turn around with a decision on these proposals put forth by the mayor. The mayor saying it's been 2 weeks and they still have not heard anything yet back on their new proposal for the second testing.
Yeah, very interesting to see that conflict there, because you have seen Governor Ige's office and Caldwell's office working actually pretty well in concert together over the last few months. So I think this is one of the first times we're really seeing, some friction there. And we'll talk to the governor on Monday and we'll ask him about why there has been this delay. And, we asked the mayor if he knows why the governor is delaying, and he says he doesn't. What's interesting is that the funding is there. He says he has the capacity, so it's not a testing capacity issue. Basically, everything is there and ready to go. So it'll be interesting to hear why the governor has taken so long to respond.
Yeah, looking forward to that conversation. Of course, the mayor also talking about his transition plans with Mayor-elect Blangiardi and saying how often they've met and the things that he's already been briefed on, bringing up some important things to note for the new mayor that would have to come in and take over this responsibility. So we'll see how that transition happens. Of course, Mayor-elect Blangiardi will officially be sworn into office on January 2nd. So in a few weeks here, a little less than a month, we will officially have a new mayor here in the city and county of Honolulu.
Yeah, and the mayor also saying that he is encouraging the next administration to keep the tier system. He says it's working and it's something that people can kind of get their minds around and understand cause and effect, that if I do this, then maybe we get to tier 3. And if I don't wear my mask, for instance, perhaps we don't. But, when we did have Mayor-elect Blangiardi on here, he would not commit to keeping the tier system. He said that he felt that the current rules were a little bit too strict on certain businesses, and he wanted perhaps a little bit more flexibility. He didn't say no, but Ryan, he also did not say yes.
And that's right. So we will have to hopefully have him on this conversation, and he'll be able to join us as much as the mayor has been able to join us during his time. And we'll try to see if we can get Mayor-elect Blangiardi sometime in the future to, of course, get an update on that. But looking forward again to more guests coming up.
That's right. On Friday, we're going to have Dr. Carl Bonham from UHERO. That, of course, is the economic analysis department, if you will, of the University of Hawaii. They do a lot of projections about where Hawaii's economy is and where it's going. So we'll like to talk to him about the pandemic and the impact it's had on, all levels of our economy. Hawaii, unfortunately, has one of the highest and often the highest unemployment rate in the country. We are so dependent on tourism, but that, of course, is a difficult thing to restart in any significant way right now. So how many hotels could we see close? How many people are going to be, laid off permanently? And how do we make a pivot to something else? So we'll be talking about all of that on Friday with Dr. Bonham.
Yeah, and of course, again, we'll be talking to the governor next week as well. We also have the lieutenant governor lined up, as well as Dr. Kishimoto also coming up later in this month as well. So we'll continue to keep you posted with our lineup of guests, and we certainly appreciate all of you tuning in every day. It's not every day, but Monday, Wednesday, Friday, and being a part of our show and being a part of this conversation. We'll see you all right back here on Friday at 10:30 here on Spotlight Hawaii. Aloha.
Aloha.